Hi, in this video I'm going to be talking about the limbic system and try and give you an idea of what it is and how it works and what the key parts involved in it are, and then put this into context with a couple of conditions which affect it at the end. So its key functions are emotion and memory. So it's involved in helping you sense emotion, and it's also involved in your body's responses to emotion. For example, when you're nervous, your palms begin to sweat. So it modulates emotion and it modulates memories based on these emotions that you felt. So there are a number of different types of memory, and these can initially be broken into long-term and short-term, and our long-term memory can be broken up further. We first have declarative memory, which is our memory of facts and events that have happened in the past. And we also have procedural memory, where procedural memory is our memory of procedures. So this is motor skills such as riding a bike, or even simpler things such as talking and walking. We can then break our declarative memory up further into episodic and semantic. Our episodic memory is our memory of our own autobiographical events. So this is our thoughts and emotions during these events, as well as our memory of the times and places that they happened. And then we have semantic knowledge. And this is knowledge that we've gained about the world through our own experience, but that hasn't directly affected us. So this is random facts about the capital city of America. The predominant part of our limbic system is the Papez circuit, and this is made up of the hippocampus, the fornix, and the mammillary bodies, and the amygdala is sometimes included. So firstly, the hippocampus, and this sits in part of the temporal lobe, and it sits just medially to where we have the lateral ventricles within the temporal lobe. And this means that when you have imaging, it's quite easy to spot where the hippocampus would be, and its part on the Papez circuit is highlighted in red here. So on this image, we can see the lateral horn of our lateral ventricle's temporal horn, just here, and just medial to this, we have our hippocampus. Now, during Alzheimer's, the hippocampus begins to atrophy, and using these lateral ventricles can help us to identify where the hippocampus should be to tell whether or not there's been atrophy in this area. The main function of the hippocampus is in memory. So damage to it, such as in Alzheimer's where you have this atrophy, can lead to anterograde amnesia, which is a common symptom. So this means that you are unable to remember new events but have some memory of past events. And although you do lose some of this in Alzheimer's, memories of when the person was younger are generally a lot stronger than recently acquired memories. Also, you use the hippocampus for your visuospatial memories. So think of the fact that when it's dark, you still know the vague layout of your bedroom, so you're able to walk from the light switch to your bed when you're going to bed at night. The next part is the fornix, which is here in blue, and this connects the hippocampus to our mammillary bodies. And therefore, as it's the outflow of our hippocampus, it has very similar effects if it becomes damaged to the damage to the hippocampus. So this is our memory predominantly. The mammillary bodies sit on the end of the Papez circuit here, and they are part of our hypothalamus. And they are involved in sending messages from the amygdala and from our hippocampus, which has travelled through our fornix, up to the thalamus. And they play a particularly important role in our episodic memory. So this is the memory of things that have happened to us and memories of our own history. The thalamus is involved in the limbic system as it is involved in just about everything in the brain. But as with most cases, it doesn't play much more than a modulatory role itself, and it helps to pass on this information. The cingulate gyrus is where it passes the information to, and this is broken into a number of areas. So it has an area which has autonomic function, it has an area involved in bladder control, and it has an area involved in the emotional modulation of pain. So you can go into more detail and understand which areas are involved in which of these functions, but it's predominantly important to just understand that these are the main functions of the cingulate gyrus. And it's worth noting that the cingulate gyrus travels here around the corpus callosum, but then continues onto the edge of the temporal lobe in what's known as the parahippocampal gyrus. The amygdala is also part of our limbic system, and it's seen here in green. And it's essentially a group of nuclei that are just inferior to our globus pallidus, as from these diagrams it can be difficult to understand where these things sit. So if you imagine they're quite medial in part of the white matter. So their main functions are in fear and anger, but they also play important roles in modulation of memories, and they have a role in smell. And this helps to explain why smell often has very strong associations with memories for people. The inputs for this area include visual and auditory information and sensations from around the body, which help to modulate the memories. And then the information is passed to the hypothalamus and the mammillary bodies and to the hippocampus to then help you build up these memories. So the first of the conditions that I'm going to talk about is Korsakoff psychosis. And the acronym I use when I'm going through conditions is CESPIT, where we have causes, epidemiology, symptoms, signs, pathophysiology, investigations, and treatment. So Korsakoff psychosis is caused by alcohol abuse, and this causes metabolic damage to the body. It happens in about 0 to 2% of people, dependent on the country, and it's much higher risk in those who are homeless or who have long-term psychiatric conditions and therefore are likely to consume more alcohol. It presents with amnesia, and one of the main signs that you'll notice when you're speaking to the patient is that they're confabulating, which means that they're making up facts about their past, and they'll be speaking entirely fluently as if it's true. So they might talk about the fact that they used to be an airline pilot and they know how to fly planes, despite the fact that you know this isn't true. This helps you to remember how Korsakoff psychosis happens. As we said earlier, the mammillary bodies play an important part in our episodic memory. So this is our memory of ourself and our own history. As this becomes damaged when you have the vitamin B1 deficiency that's common in alcohol abuse, you're unable to remember your own history, and so you begin to fill in the blanks with these false facts, and so you have these confabulations. It's investigated mostly using medical deduction, and you can test for thiamine levels within the body, and you would treat by giving thiamine to try and reverse the damage. And the final condition is Kluver-Bucy syndrome, which is where you have bilateral lesions affecting the amygdala on both sides, so it's incredibly rare. But again, it can help you understand what the amygdala does, as the amygdala is predominantly involved in fear and anger, so you lose these fear and anger responses, and the person is incredibly docile, they'll be difficult to anger, and they may be exploring a lot, and they often show signs of being hypersexual. Thank you for listening. Please let me know if you have any questions. Thank you.